Welcome to Elevated Practice, where we interview masters and mavericks within the field of holistic medicine and uncover unconventional stories in the field of health and wellness. I'm your host, Gretchen Badami, and every episode I'll be interviewing clinicians, scholars, entrepreneurs, and educators who share their wisdom and ideas with you. Are you ready to elevate your practice? Let's begin today's episode. I'd like to extend a big thank you to Handcraft Health for sponsoring Elevated Practice and empowering integrative healthcare practitioners to create personalized healthcare packages for their patients. Create a free account today and elevate your practice at www.handcraft.health. And now, on to today's episode. Hello and welcome. We're here today with Dr. Amy Major. Amy Major is a doctor of acupuncture and Chinese medicine who has been in private practice both in California and Massachusetts for over 35 years. In addition to being a Chinese medicine doctor, she is both a birth and end-of-life doula, a lactation counselor, certified hypnotist, and Faybourn Fellow specializing in reproductive medicine. Amy has had the honor of apprenticing early in her career under Miriam Lee and Raven Lang. Amy has been published in numerous books and journals, ran a biweekly health radio segment for 10 years, and her CV boasts more guest lectures and interviews than I could count when preparing for this interview. Amy is deeply involved with state and national professional politics and advocacy in the acupuncture and East Asian medicine field, working to affect the acupuncture scope of practice and secure acupuncture as an insured and verified treatment for pain, promoting bills on the safe practice of acupuncture in Massachusetts, and she testifies regularly in the State House. Amy has served on the board of the American Society of Acupuncturists, the ASA, since 2016, and has served as their vice chair and on multiple committees such as Federal Advocacy for Medicaid, Insurance, Research, and Herbal Medicine committees. Amy has also served on multiple committees and task force for the National Certification Board, NCCAOM, which is now known as NCBAHM, the Board of Safe Passage for Survivors of Domestic Abuse, and the Board of Acupuncturists Without Borders. Amy, without further ado, welcome, and thank you so much for joining us here today.
Thank you so much for having me. And just to be clear, I am no longer on the ASA board. I timed out after 6 years. So I was of service there, and now I'm currently our federal advocacy chair.
I mean, you have done your time putting in work and advocacy across so many areas of our profession. And this is one of the main reasons I wanted to have you on here today, is to share some of your wisdom, some of your experience, and the knowledge that you've learned about interacting within these institutional frameworks and organizations of our profession. So I'm really looking forward to that. But I just want to take 5 minutes before we start, because you've done some really cool things throughout your training. And as you were learning this medicine. So I just wanted to ask if you could share a little bit about the evolution of your own practice and some of the unique experiences you've had as you were learning this medicine and developing some early specialties.
Sure. Thank you so much for the opportunity to share this. So I was at the American College of Traditional Chinese Medicine from 1986 to 1989, and all but 2 of our instructors were trained pre-Cultural Revolution, which was a different framework. We did not have Bensky, not even the first Bensky. We had to write down in character the herbs, and we wrote down in English and wrote down what we could in Chinese, because every statement was said in English and in Chinese. Chinese first, then English, whether it was point location, traditional function, qingde, clear the heat, whatever it was said in Chinese first and then in English. And, when Bensky first came out, the first version, it was coming into our second year of acupuncture school, and there were no page numbers on the pinyin side. Nothing. There were no tabs and no page numbers. So I went through the entire book and put all the page numbers for the pinyin, because we learned the herbal medicinals in pinyin. It was a good exercise.
Oh my God.
And I recommend any students go through the book as well and highlight the name in yellow, and if it's cool, use a blue highlighter. If it's warm, use an orange one. And if it's hot, use a red one or a pink one, because, we take information in different ways.
Students have it so easy nowadays. They have no idea.
They have so many books. We had the Essentials of Chinese Acupuncture. It was tiny. There was no CAM. There was no Deadman. There was no Giovanni, you know, but we learned a lot. And, we also were humbled by our professors, Dr. C.S. Chung, who created the Harmonious Sunshine Cultural Center and was one of the founders of the three-legged stool, right? When we diagnosed, we used a three-legged stool. Well, there was a three-legged stool of leaders at ACTCM. And he would take students that he liked. He didn't do this with everyone, and I don't know why, but I felt very touched that he invited me into his office. He pointed to a suitcase under his desk. He said, "This is the suitcase I brought with me to the concentration camp in Burma when I was sent there for being an intellectual. I keep it under my desk because I will not be broken. And if I am asked to go back, I will go back. And there is my suitcase." And the strength and resilience of this man taught me so much. And I had a friend, Michael Schbach, who was apprenticing with Raven Lang. And I was like, "Oh, I'm so interested in birth work. I have to contact her. I would love to do this. I don't know." And he's like, "Here's her number. Call her." I didn't call her. I didn't call her. I didn't call her. Finally, I get this phone call. "Hey, you're Amy Major?" "Yes." "Why do you want to do birth? What's your experience? What can you bring to my practice to make my job easier? Because
Wow.
this is not going to be one way. How are you going to show up for me?" And we ended up getting along profoundly well. We worked very well together. We would show up at work wearing the same thing, like red on top, black on the bottom, blue on top, purple on the bottom. Every week. There was no discussion. It just was organic. And because I studied with Raven, because her notes were like plum blossom, double sun, double fairy. What does this mean? Well, unless you study with Miriam and Dr. Tung, Susan Johnson's book makes these really clear. But prior to that, everything was done in numbers, unless you had studied with Miriam and knew the names of the numbers, which is much easier to remember,
Ah,
right? So, you would go and you would just write for 2 days and listen to Miriam and write. And I'm grateful for that privilege because it really informed my practice and who I am and the provider that I have become.
yeah.
Everything that we experience brings us to who we are. And that's part of why I explored trauma informed care through Acupuncturists Without Borders because of some life experiences and also wanting to make sure that other people could have support and healing for their own lived experience with trauma and PTSD.
Mm.
And we were, I believe, the last group of people that had to take the NCCA exam. There was no OM yet in 1988 around the rules for autoclaving and cleaning needles. Because in the height of the AIDS crisis in San Francisco, we were soaking needles, cleaning them, sterilizing them, right? And using and putting indicator tape inside, outside, dating them was a lot. And all of that information was also on our NCCA exam because we were required to have it. Now, of course, we use sterile single-use disposable needles in order to get malpractice insurance.
Of course.
But times have changed.
Wow. I mean, you were studying during this amazing time of transition where it was the Wild West when you first
Yes,
started.
absolutely, because every school had their own ethos. I mean, they did have to meet ACOM standards, but this was before ACTCM was either the first or one of the first schools to have an accredited master's degree, which is why I went there, because at the time there were only certificate programs. And I felt like if I was going to school for 4 more years, I needed a master's degree. I
Yeah.
wasn't going to walk away with nothing. And thank God I did, because that let me take the doctoral program and earn my doctorate,
Yep.
for which I'm profoundly grateful.
Yep. And when you were first learning and then first practicing for those first years out there in California, is that where you then deepened your knowledge of doing birth work and then also hospice and end of life care and death work? And is
Really, my grandparents pulled me in through hospice. And I at Brandeis, my mentor was a man named Dr. Maury Stein. The
oh,
Tuesdays with Maury is Maury Schwartz. So I would
mm,
kibitz with Maury Schwartz while I was waiting for my Maury Stein. They were best friends.
oh my
And they
God.
did a bunch of work with Ted Koppel together around Maury Schwartz's ALS diagnosis. There are a number of videos that people can look up if they want to see the dialogue between these two extraordinary men. Maury taught a class called Birth and Death, the sociology of birth and death. And in that moment, it was like, am I going to be a midwife or am I going to do adjunct support work with midwives? And as soon as I decided to do adjunct support with midwives, that's why I wanted to work with Raven. I became a birth educator right after I left California, birth educator and birth assistant. I did trainings through an organization that doesn't exist anymore called Informed Birth and Parenting. And then I studied with 2 different midwives who taught through this system to become an advanced birth assistant. They taught us to do things they don't train doulas to do now, which is, they took grapefruits and put sutures on the grapefruits with yarn and then covered them with saran wrap and put them between a woman's legs. And we had to palpate and determine which way the baby was facing. What was the lie of the baby? So I got tremendous experience. And I also did some studying with Gail Peterson, who created a system called body-centered hypnosis. She is one of the people who was really advocating for normal physiologic birth. She has a very science-heavy book called Birthing Normally with Louis Mail, PhD,
Mhm.
MEHL. And I was just really fascinated by tone and language. And so since then, that's something I always bring into my office. And the hypnotherapy also led me to change how I use language and tone in my office with every patient, right? Because not everybody can afford hypnosis and it's not a thing. But when we set the frame at the beginning of a treatment and we bring ourselves into what my children call, oh, you're using your patient voice, when we're in that space of centeredness and connecting with the source that moves all things, however we call it, then we are coming from a place of love and healing. And then that just opens the portal, however we want to describe it, for that to happen in our treatment rooms.
Yeah, yeah. That's beautiful. And when we think about how we interact with the patients and what sort of work we are here to do with the patients, to be able to have that mindset and then help to teach or convey a space that is a safe space for the patients with that understanding. I mean, we can give them all the herbs and all the acupuncture in the world, but what does it really come down to in terms of the energetic space that we're interacting with the patients?
Absolutely. And before I leave the room, I ask every patient three things. Do you feel safe with me? Do you feel safe in this moment? Do you feel comfortable? And is there anything else I could do to make you feel more supported or more nourished in this moment? Because how often are people asked that question? Never. You know, just creating the possibility creates the possibility of a shift in perception for patients, which opens the door to tremendous healing, at least in my lived experience, which is all
Yeah.
I can speak to.
I mean, you were learning this medicine at such a profound time where you had so many opportunities with people who we all now in retrospect know as very famous and well-known and influential people in our
Hmm.
field. And I'm grateful to have you on the podcast today just to share even little bits of that and the fact that you knew those people and had the ability to learn from them. When I first had the idea for this podcast, one of my inspirations was knowing that there was so much in our medicine in the 80s and 90s that now people are aging, that I wanted people to be able to share stories of their teachers for the younger generations.
Absolutely.
Not only the facts,
Mm.
like treatment protocols or herbal protocols, but the ethos around where our medicine came from.
Yeah. And it was super different. One of my friends who shall remain nameless about 5 years ago needled me through clothing. I said, "You cannot do that." And this person was like, "Well, Dr. Lai did that." I
Yeah.
said, "Number one, Dr. Lai was Dr. Lai, and that was 50 years ago. Now you could get sued for that. I am not
Yeah.
going to sue you, but please don't do that. It is
Um,
outside of CNT protocol. And, just because we learned it doesn't mean it's within our practice act. So I
some
encourage
things in
everyone.
society have changed.
Right. And I encourage everyone to know their practice act because it's extraordinary the number of people that have never read their own, just in
Yeah.
terms of what's covered in terms of things like laser, gua sha, tuina, massage. Can we use the word massage? All of those
Yes.
things matter. And my practice act was different in California, right? I was only there for a year and a half practicing. I lived there for 5 years,
Yeah. Yeah.
but
This was a pretty good segue to bring me to what I wanted to talk about today, which is talking about how we bring value to our practice, both for ourselves as a practitioner and then to our patients and their experience of our treatments. And then how do we bring that out to the macro level of the entire professions? If I can first just start asking you about, okay, lived in California, you moved back to Massachusetts, and from my understanding, when you moved to Massachusetts, that is when you started to practice and get more involved as a practitioner with your community, developing resources and developing a framework for resources for your patients to make referrals. Can you talk a little bit about, for new practitioners or for people who are just starting out, what sorts of things are useful for yourself as a practitioner to have a structure within your own
mhm.
practice? And then what do patients need when they come to see you?
Okay, so one is I just want to reflect that when I first moved here through Andy Ellis, I was buying herbs from Andy Ellis at Spring Wind. And he's like, "Oh, do you know Sharon Weisenbaum? She's looking for someone to rent from her." So when I first moved back, I was renting from Sharon before she moved into her own space and started her farm. So communicating with her, and I did some admin work for her for one of her women's herbal medicine classes. So find yourself teachers and mentors who
Mm,
inspire you. That's rule number one. Number two, I want you to flip the script on that. The first is not providing value for ourselves. The first is looking at our own why and providing value and service to our patients. That's number one. Because when we provide value to patients, then they come back and they tell two friends and they tell two friends and
yeah.
so on and so on and so on. So what is your why? Who do you want to serve? For me, my mother was in the first class of patient advocates in the country out of Sarah Lawrence College. So for me, that meant healthcare is a right, not a privilege. Advocating for insurance, taking every insurance that's covered, right? And in my case, and I'm not saying this is a model that works for everyone, but I know teachers who don't have acupuncture coverage who were in the middle of chemo, who weren't making money, who had no insurance, and I saw them for free. I keep slots to see people for free who need them. And I rotate, those slots, but I keep them and I use them. That's what works for me, right? And you have to find what works for you. Am I the person with the largest business acumen? I am not. Everything has worked out, but I have this deep trust in the master of the universe. And I went there and I worked hard and did my due diligence and made sure that everything I'm doing is compliant within what we need to do within our Practice Act, within the current laws, and provide presence and possibility for patients,
Mm,
because we're in a unique position that upsets some people that we have to do all the translating. We have to translate the biomedicine into the magic that we do. And what a pain in the tuchus that is. And why does it fall on us, right? Well, it falls on us because we're the only ones with that ability. Because unless there's a medical physician who's gone through our whole program, they don't have the language or the understanding of the concepts to do that. And it is our job to teach them. And that's part of life. One of my kids was 4, another one was 2. She was crying in her car seat, and he turned to her and he said, "Esty, sometimes you just don't get what you want when you want it, and that's part of life." And that's part of life. So figuring out, okay, what do we want and how do we get there? Do you want to work for someone else? Because for some people, right, if I had not had the experience of literally chasing Raven, who ran 5 rooms when I studied with her, my friend Maggie Barilli studied with her at the end of her career, and she ran 1 room at a time. She was running 5 rooms with timers on the bottom, and it was my job to help remind her who needed what when, make sure cups came off. Then we covered every patient. This was a Miriam Lee thing with tea boxes. So she puts the needles in, she goes out, okay, cover them. So you're using these wooden tea boxes that are not light and that can crash. And you're having to create architecture. It's like Jenga, and then put a blanket that wasn't light over that. Right now, what's my translation of that? Because Miriam felt like just the act of putting a needle in is sedating, even if you're tonifying. So I use a Mylar blanket. Every patient gets a Mylar blanket. And I tell them, if you bring it back, I will use it only on you. If you don't, I'll give you another. Nobody gets blanket shamed. People are like, "Oh, I don't want to take another." Okay, well, guess what? You can give it to an unhoused person. That's going to be really valuable and helpful to them in the winter. So there's different ways of recycling things
wow.
and bringing what we learn into our practice. So having seen someone run 5 rooms, I can run 5 rooms, no problem. And that came in really handy doing Acupuncturists Without Borders type clinics in Springfield after a hurricane, and also after a tornado in Puerto Rico. A lot of the community members are from Puerto Rico, so being able to support them with community trauma clinics made a huge difference.
So building up a framework and a resource network as well to
Absolutely.
not only, of course, what you do within the office and within your practice time, but then, what else do your patients need that maybe you can
Well,
refer them to?
midwives, really good PCPs. They want PCPs that are going to listen to them. They want to know, where can I go for my mammogram? There's a place, I live in Western Mass. In Eastern Mass, there's a place and I go there. Why? Because at the Boston Breast Diagnostic Center, you get your results when you walk out. A medical
Mhm.
physician meets with you after you have your scan. So you don't have to wait a week to get a piece of paper, right? That makes a difference.
Yeah.
That's a practice that's filling a need and providing a service that gives value. Right? So what can we do with that, right? Knowing who the midwives are, building relationships with them if you're working in birth,
Yeah.
right? Knowing the GYN docs, the fertility docs, the PCPs, and the neurologist. I had a patient with an untoward outcome who had seen a neurologist, and then he went to the hospital, and this person was a person of color, and he was treated like a drug seeker, and it was awful for him. And he came into my office and he's like, listen, I got leg pain, but it's from my back. That's what the doctors tell me. It's from my back. I understand that, sir. I need to take a look at your leg. You don't need to look at my leg. He was like, you know, bordering on, can I see this person? Right. So he went on and on. So put him face down, asked permission to move his pant leg, moved his pant leg. There was the hugest embolus I'd ever seen on the outside of his leg. I said, sir, I need you to get up and go see your doctor right now. I'm not going to do that. I was just in the hospital. They told me it's fine. I'm here for acupuncture to help with my pain. Okay, sir, I need to write in your chart that the advice that I gave you was to go immediately to your provider. Why? Because if you don't chart it, it didn't happen. And when things like this happen in our offices, the way that we protect ourselves and our patients, right, if they're going to do a lawsuit, is to write these things down.
Yeah.
So long story short, he felt better after the treatment. Then I didn't hear from him. So I'm like, oh, okay, maybe, he didn't like it. He was upset that I spoke to him and tried to encourage him to see his provider. 3 weeks later, I get a message on my answering machine. Hi, I just want to thank you for saving my life. I walked into my doctor's office and they called an ambulance when I showed them my leg.
Oh my gosh.
Then the whole office was apologizing to him because not one person had looked at his leg.
You were the
So
first person to look at his leg.
correct. So physical exams and physical touch makes a
Yeah.
difference.
Yeah.
Like almost every one of my patients gets toina gua sha. Why? Because, my husband's a network chiropractor. Chiropractic is all about tone in its pure form, right? The tone of the muscles. And for us, like we're looking to create the dynamic balance, right? That's in constant motion that generates life within the organ systems. So I have a habit of touching different places, not just if their neck hurts. I'm going to touch gallbladder 34 and behind their calf and see what's going on there and
Yeah.
see what I can get to release, or spleen 9, spleen 10, and just touch, connect with their body and ask their permission, of course, first to palpate those places. Sometimes we palpate specifically to put a needle in. Other times we palpate to get a sense of the whole system and how it is functioning or not.
Yeah.
And all of these things make a difference and provide value because nobody else is doing them, especially now.
That is such a good reminder that, right, nobody's touching patients, certainly not when they're going in for primary care. They have 5 minutes to say what's wrong with them and get a prescription. And number one, it feels good, right? Someone is going to feel connected with you if you can give them a little bit of a massage, a little bit of a tuina. You can show that you care. But all of the diagnostic information that you learn from that patient, from every time you see them checking out their body or touching different areas and muscles, and my God, the few random times when you're actually going to save a life from it
Right. It's
unexpectedly.
unexpectedly.
Yeah.
Another patient came in during the height of COVID. She was in her early 30s and she clearly had classic signs of Parkinson's. And the frame she was using, though, was, my body's really activated. I'm really stressed. I want to divorce my partner, blah, 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 blah. And I said, I hear all of that and I'm happy to treat you. And I watched the way she responded when I treated her. And it looked like a duck and quacked like a duck. And I was, I could not give the diagnosis, but I was 100% clear that it was Parkinson's.
Yeah.
So I said, you know what? We're going to work to get you a telehealth visit with somebody from Boston, from a teaching hospital. So we did that. And within 15 minutes, she had the diagnosis.
Wow.
Why did her first provider not consider the diagnosis? Because of her age. And again, we're trained to consider the patterns. And when something is out of integrity like that, we know, and we have to be able to translate that for the patient to be able to advocate for themselves with their medical provider, who in this case, the guy totally poo-pooed her because of her age.
Yeah.
Well, sir, we need to go back to the three-legged stool of diagnosis and what do we see?
Yeah.
And what do we know?
This is so important for, I'm going to say especially new practitioners, but geez, for all of us. I've been in practice now for almost 20 years and I'm hearing this and I'm thinking, oh, what a good reminder that as integrative practitioners, we are a part of an entire network. And of course, we're never going to do it all by ourselves. And despite the fact that our medicine is amazing and our diagnostic system is, in my mind, superior to any other, we still are not expected to do it all. And we can't. And to have these referrals, to have the knowledge to connect people with what they need, and you're not giving away the patient. Those patients not only are forever grateful to you, but now you're going to be their person for their holistic care while they're also seeing a specialist.
Right. And something I say to every patient is, so I'm looking for feedback. Are we a good match? Because if we're not, I have friends who are phenomenal providers who are really different than I am. And this is not about me. This is about you, because people feel like they work for their providers. And I say, we work for you, not the other way around. And so I want to make sure that you are getting the most profound care that you need to be the best version of yourself. If that's me, that's fabulous. If it's not, I want to bless you and help you find that person if I can refer you to them.
Yeah, you're actually providing the most compassionate care by holding true to your structures of frameworks of what you should and should not or can and cannot be providing for the patient and being the best that you can in your own, toolbox.
This is one thing you can choose to do. You can choose to do this. This is one way to look at this is another.
Yeah.
And just making sure that the way that I share information is just working with them as an equal,
Yeah.
as a person to person, heart to heart, sharing chi, sharing life force,
Yeah.
because people can hear so many more things when we come from that place. At least, for me, someone else may have a different method, and a different MO that works better for them.
And I'm imagining thinking about the ripple effect of this as well. I'm imagining that when you have made these referrals because you have been able to make a diagnosis in your own diagnostic, skill set to know where they need to go. I'm assuming that those Western medical professionals, I'm sure that they're like,
Oh,
"Oh my God,
yeah,
thank
they're
you for referring this
shocked.
patient to me. Like, what is it that you do again? Like, let
I
me
get
refer more people."
from this one orthopedic surgeon, I get tons of referrals from them because they know that I know what I'm doing,
Yeah.
and they have that lived experience. And there are definitely providers and chiropractors and other providers, and I refer to other people too. I refer to PTs. I don't refer to PTs that do dry needling, and I do educate every single one of my patients about why that's not a good idea for their own safety. All you have to do is say, a physical therapist must take a third-party national psychometric exam to give exercises. And we have to do that for acupuncture, Chinese herbal medicine, foundations of herbal medicine, and biomedicine. But did you know that your friendly neighborhood dry needling provider has taken a maximum of 75 hours, inclusive of classroom and clinical hours, and more likely 25? And they don't have any third-party national exam to take. So I'm all about people doing things as long as we have meaningful standards and best practices and a framework within which to do that.
For everyone who's listening right now, you can stop and rewind and memorize that script for the next time you talk to patients about dry needling. No, but it's so true. And in this way, knowing how to be an effective and reciprocal integrative practitioner will end up bringing patients back to you once the rest of the medical community understands what you're doing and what you are good at. This is how we create our community and our network. And it just sounds like you've had 35 years to be doing this, but geez, you're really, really showing some good examples of how this can be done. Let's pause for a moment to extend a big thank you to our sponsor, Handcraft Health. I prescribe a lot of herbal medicine in my practice. And quite frankly, I don't want to spend the overhead keeping hundreds of herbs and supplements on hand. Since the pandemic, I do a lot of telehealth consults and ship patients their prescriptions. Handcraft Health has been my lifesaver. It allows me to have a successful and streamlined practice and saves me money and office space. I am not tech savvy, but the platform is really straightforward for me to write and easy for my patients to pay online and receive their orders at home. It's free for practitioners to open a Handcraft Health account. It's just handcraft.health and only takes a few minutes to sign up. It's one of the easiest choices you'll make to do what you do best. And now, back to our episode.
Oh, my pleasure, truly. And I've learned a lot. I mean, my husband's teacher, Dr. Donald Epstein, who's the founder of Network Spinal Analysis, I've taken some seminars with him, and I'm very open to learning from different healthcare providers to bring back what I can to be of service and in service to my patients with the tools in my box,
Yeah.
right?
Yeah. One thing that you were mentioning earlier, and it's sort of a logistical thing, but geez, I
Yeah,
wonder if you can explain this to our listeners.
yeah.
You had mentioned making sure that regardless of what state you're in, you know what's in your scope of practice.
Hmm.
And I mean, I know even for myself, I oftentimes am not one who's good with the particulars and the details.
Yeah.
And I remember when I just signed up for my malpractice, I just signed up for something and I don't think I ever read what was in it. What are the reasons? What are the things that a new practitioner, what is someone looking for to see what is in their scope of practice? What could either be covered or not covered that could come back to be problematic for us later?
So the word massage, it is forbidden in Virginia for acupuncturists to use the word massage and say they do massage. They can say they do Tuina, but they can't use the word massage. We can in the Commonwealth of Massachusetts. And that matters in terms of treatment notes. It matters in terms of billing codes. And it matters, a provider, a dear friend of mine who was Asian, the massage board tried to sue her for practicing without a license because she had a sign that said Toina Massage. And
Oh,
she had to hire a lawyer to deal with that.
oh my
But
gosh.
she knew, she called me and we talked about it. Nope, it's in the Practice Act and let's get you supported. And she was supported by a number of people
Wow.
to help her get through this. But she had to spend a lot of money to do that. And that was silly because it's part of our Practice Act. And that was another board suing our board over something that we do. So it's important to know things like that. Are you allowed to prescribe supplements or not? We are in the Commonwealth. It's important
Mm.
to know what kinds of recommendations we are allowed to make and that we are protected by in our Scope of Practice Act and not. There's a very famous provider who I shall not name who lost his license because he encouraged a patient not to do chemotherapy.
Oh,
And so now you can only get malpractice if you're treating cancer patients, right? I'm a member of the Society of Integrative Oncology. And if you're treating cancer patients, you can only get malpractice if the patient is also being seen by a biomedical provider. Otherwise, we're not supposed to see them. And it depends on your state. And it doesn't mean that our medicine is less powerful. It does mean that we have to stay in our lanes of what we do and what we don't. When I have patients who say, I don't want to be on this medication, I said, well, here are some ways that I can support you. Here are some things you can do with food, some things you can do with lifestyle. And when you feel like you want to have that conversation, I need to refer you back to the provider that prescribed that medication. And here are some things you might want to share with them. We can give them ideas of how to talk about it. But the moment we tell them not to take it, at least in my state, we can lose our license.
wow.
So that's something to be aware of.
So in many cases, it's not even about a particular service that we're providing, but it's also what we're calling that service, the words that we're
Yes.
using, and
Yeah.
and then we always think it's going to be such a fringe case, like this is never going to happen to me, but clearly it does happen to
It
people.
happens. And I want to encourage everybody out there to really consider using electronic medical records, electronic health records, because you can't lose them. And to chart as if every patient has had a car accident, because you never know. I learned this from a patient that came in, blah, 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 blah. And at that time, my charting was not where it is now, and I've learned a lot over the years and raised my standards. So if there's an insurance audit, I can pass it. And so it protects you profoundly. And chart when things happen, when they're happy, when they're sad, patient has a reaction to a cup, write it down, write down the conversation you had with the patient, date it, time it, because that protects you.
Yeah, and the electronic medical records, of course, everybody in this day and age should be doing it. And I know for people who maybe have been practicing for
They're
20 or
not,
30 years, maybe they don't
yeah.
want to switch, but still so beneficial for the practice on so many levels, not just logistically, but it also, you know,
Well, logistically, online
legality.
scheduling, hello, my best friend.
Yeah.
Because young people don't want to talk to you. They don't want to ever call you on the phone and they're not going to pick up their phone. They might text you,
Yeah.
but they prefer online scheduling. Of course, my elderly patients prefer to do it. Most of them, some of them are Luddites. Some of them are happy with EMR, but you just have to do what works for the person in front of us. That is the deepest value of our medicine, right? Is we are able to treat each patient with their unique constitution at this unique moment in time.
Yep. Yep. Wow. So Okay, so this was the first part of what I wanted to talk about. So two things.
Sure.
First, this micro level, so your practice. And I mean, this information about the Practice Act, which seems so trite, but oh my gosh, I'm sure there are so many people out there right now listening to this who have never read their Practice Act, as I know I didn't. So make sure you know what state by state and the idea of being an integrative professional and referring and creating networks within your practice for your patients. So thank you for sharing all of that. I want to transition from the micro to the macro level.
Hmm.
So as an individual practitioner, one of the ways that when I first started practicing, I remember I loved going to conferences and really getting to network with other practitioners and getting to
Uh-huh.
meet some of the entrepreneurs in our field and some of the companies and some of the movers and shakers in our profession. And then starting to join things like local boards or local chambers of commerce, right? So within our practice in our towns or our neighborhoods, these are all things that an individual can do. And then
Absolutely. Rotary. Some people love Rotary. That's another thing they can do. Chamber of Commerce.
yeah,
I'm offering free talks.
yes.
Recent NISA graduate, Angelique Britt, is giving a talk at our co-op.
Uh,
And, she has really deep skills and she's an RN as well. So play up what you have. I do a lot of birth work and end of life work. What brings you joy? What skills do you have? And how do you want to market yourself and make people aware of you with authenticity about what brings you joy and how best you can be of service? So
yeah.
you will be of value to patients and they will value you.
Yes. And doing those things out in the community will not only get you patients, depending on who you're lecturing to, but then also other professionals and other providers will learn about you. So this can then cycle back for referrals and get you comfortable public speaking. And this is my next question.
Hmm.
Amy, you have done so much within the professional, political, legislative realm for our medicine and have been very involved now for what looks like a few decades. I want to ask first, how did you get started doing that? What motivated or inspired
Okay.
you?
So Linda Robinson Heides in Massachusetts called me and said, I know what you can do. We need you. Your youngest child is big enough because I have 6 children. I have 5 children in 8.5 years. And then my baby was 4 years after that. This was 2014. Dry needling really became an issue in 2009. And she asked me to join the Acupuncture Society of Massachusetts board and become the dry needling lead. And I took
Mm.
this very seriously. And we had a bill. Our then bill was about having only acupuncturists be able to do it. We have since changed that plan to creating standards for dry needling. And that bill is currently in the legislature right now. We're waiting for it to be moved out of committee. But so Linda brought me on and I got very involved and I took testimony seriously. So I wrote to Ted Kapchuk and asked him for a letter and called him. And Ted wrote this great letter. And I wrote to Mark Seam, who knew Janet Travell, and asked Mark and spent hours on the phone with Mark. And Mark sent me a 20-page letter. I said, okay, sir, I need to whittle this down. Do I have your permission to work with you on this? So worked with him to do it. Corey Ward Cook was the then chair of the NCCIOM. And I said, okay, so PTs are doing this training. They have a certificate program. They're calling it a certification. I know the difference most people do not. I need you to write me a document that talks about the difference between a certificate program and a certification program. And by the way, I need it in 2 weeks. And she got it for me. So, because when it's written by a PhD and she's the CEO of our national certifying organization, that carries gravitas. So when you're testifying, you want to look at, you have nothing to lose by asking people. They can only say no. And I got a lot of yeses. And we created this entire book of testimony. And that's when Rebecca Schieber suggested that the ASA try to pull me onto their board. And then I got pulled onto the ASA board. And I was on that board for 6 years and became the vice chair of public policy and learned a lot through doing federal advocacy work with the NCCAOM and the ASA and the AAMA and building bridges with the ATCMA, lots of acronyms
Yeah.
and just learning like about all the different threads. Where do they go? How do we link them? How can we be more cohesive? Because acupuncturists tend to be like organizing them as like herding cats.
Yeah.
So how can we get people behind certain ideas to make a difference? Because we have to work as a cohesive group to make a difference. A legislator told us he had had a legislative meeting, and somebody in the meeting, one of the acupuncturists in the meeting said, well, it was about insurance legislation. I'm not going to take insurance. And the legislator got up and walked out. So know who you're bringing with you to your meetings
Yeah.
and have talking points. And some people may be in listen only mode at some
Yeah.
meetings, and that's okay,
Yeah.
right? Not everybody has to speak, but if you want to have power in numbers, we have to have cohesiveness, or we're going to create more problems than we're going to solve.
Well, and this is okay. So, power in numbers, that's something that I've been thinking about for a while now. I'm very active on social media for
I know.
acupuncturists, and so are you. Usually, I'm just passively observing. Sometimes I get involved in the conversations, but overwhelmingly for years now, what I've seen is that people in our field, acupuncturists or doctors of Oriental medicine or herbal, everyone has an opinion about everything. And there are a lot of things that are either upsetting or confusing. There are a lot of changes happening. Everybody wants to give some input and be upset about what is going on, but nobody wants to get involved, or people don't know how to get involved, or they don't even think to get involved. I'm not sure where the problem lies,
Well,
but
so
you
some
are
people,
involved. And so
yes,
people
you
need to
have.
learn how to get involved.
Sure, the best way to get involved is to join your state association. There are 34 member state associations of the ASA, the American Society of Acupuncturists, which is our largest professional trade association. The ASA has a seat at the AMA CPT code table. Most people don't think about that. What am I talking about? I'm talking about 97810, 97811, right? Those are the acupuncture codes. We have a seat at the table, at the complementary medicine table, basically, that discusses the non-medical physician table that discusses codes. Anna Panettiere is representing the ASA at a meeting that's happening right now. And these are really boring meetings because it's just code after code after code after code and arguing over minutia and a comment and a little word here. But you know what? Somebody has to do the boring grunt work, or we are on the table, not at the table. And so it takes a lot of time to learn how to be effective. It depends on the context. Sometimes it doesn't, but getting involved matters, and making sure that your messaging, if you're working on a specific issue, talk to the leaders who are doing it. If you say you feel frustrated, why are they doing it this way, not that way? Ask them, but ask them in a way that doesn't demean them, right? We
Yes.
don't have to have ad hominem attacks to have understanding and to have deep and meaningful conversations about, that is a great idea. And this was considered 8 years ago, right? Like our previous bill was about not having anyone other than acupuncturists perform dry needling. Well, that horse went out of the barn. How did it get out of the barn? Well, one state didn't have not California, didn't have the NCCIOM exams. So if you don't have a third party national psychometric exam, you can't make the argument that anyone inserting a needle should pass a third party national psychometric exam, right? And it's not lost on me that that particular state was the first state that dry needling was allowed in.
Yeah.
So we want to be mindful not only of what I want in this moment because it feels good, but what does that look like 5 years from now, or what could that look like? And are there repercussions that could come back on us for handling it this way?
Yeah.
You have to be able to pivot. Like we pivoted to standards for best practices for dry needling, and we're still getting lots of blowback, but we're continuing to do it. And every year we get more people involved who understand why it matters. So I don't know if it's going to pass, but someone's like, are you ever going to stop? I'm like, not till I'm dead, you know? And in part because I have had conversations with the chair of the APTA more than once, asking directly, so please explain to me why, when a PT needs a third party national psychometric exam to give exercises, why they don't need that to do an invasive procedure like needling. She's like, we just don't. I don't find that a satisfying answer, personally, you know? So I'm going to keep banging on that door.
You're there pushing those buttons and trying to get accountability from those people. And
Absolutely.
if you or other people who you work with, if nobody is there to get and to demand accountability from these people, then this is exactly how laws can be enacted when nobody's looking, right? When no one's paying
Right.
attention.
No one's paying attention, and then the law's enacted, and then everybody's upset,
Yeah.
and then everybody says, why didn't you do this for me, rather than, oh my gosh, I personally missed it, we all missed it, what can we do to mend it now, and how can we become stronger through this?
Yeah. I first noticed this back when I was working in the colleges, and I've worked as a professor for a couple decades, but then also I worked for about 5 or 6 years as an associate dean, and I went to some of the Council of Colleges meetings for a couple of years, their
Hmm.
biannual meetings, and so I had a lot of, like, background information on what was happening with the schools and the colleges, and then I would go to work every day at the school, and I
Hmm.
would just hear students complain about this and
Hmm.
that,
Yep.
and one of the things that I found most rewarding was sitting down with people and explaining to them so that they just weren't so angry and
Yeah.
uninformed all the time.
Right.
And
Yeah.
this is what needs to be happening now. I see people shouting on social media and in these
Right.
Facebook acupuncture groups. They have no idea of the details. Thank
Hmm.
goodness
Right.
sometimes you're able to get in there and give them, this is what's happening in
Absolutely.
dry needling, or,
Or
but
this is why we need a national certifying association. And
yeah,
guess what? Nobody asks the nurses why they have to take the NCLEX exam. And nurses don't complain about it. They do it because that's the price of entry. The price of entry is the CALE if you're in California or NCCAOM if you're elsewhere.
yeah.
And it's not negotiable because otherwise we don't have best practices. And once we start thinking about deregulation, then why do we have a license and why do we go to school? And why does that matter? And it does matter because evidence demonstrates that undertrained and underexamined professionals have more adverse incidents.
And so, one way then that practitioners can start is just simply by getting involved with their state organizations.
Absolutely.
Oh,
Absolutely. That's the basic way because, you know, what inspires you? It might not be dry needling. It might be, we want to get acupuncture injection therapy. Okay, so ask your state association to start working on that.
yeah.
The NCCAOM now has a certificate program for that as well. Do you have herbal medicine licensed in your practice act? Do you want to get it licensed? Do what you're passionate about because people are more effective when they're advocating for something that matters to them, right? Or that matters to someone they love.
Thinking how I've heard so many people for years now say, I don't want to give my money to my state organization because they don't do anything. And what I'm
Well,
hearing from you is nothing's going to happen unless we all get involved.
100%. Do you have a lobbyist? Guess what? Does a magical fairy come down and pay them? Likely not. Our dues in Massachusetts go a lot for our lobbyists. And it's really important to remember that your lobbyist isn't just there to run bills. They're there to attend certain meetings to bring your attention to, there's a Good Samaritan bill. Oh, and they want to use, do we want to have feedback on it? And I absolutely gave feedback on the Good Sam bill because acupuncture was not specifically listed as something they couldn't do. It is now.
Yeah.
Now I'm working on Chinese herbal medicine because anything that we have licensure for should not be covered by a Good Sam bill. That's my opinion. People who are really about deregulation don't want that, but I do want that, because best practices protect patients. And as a healthcare provider, that's part of my job is to protect patients, not just in my office, right?
Right. Can students join state organizations as well, or do you have to be licensed?
That's a great question. It depends on your state. In Massachusetts, students are free.
Uh,
In other states, they can join for a minimal fee. So it just
ah,
depends. And many states have a board, not all, but some have a board position for a student. So that's a terrific way to learn, to grow, to become involved, and to
yeah.
think about how you want to practice. And you've also, if you serve on a board, you get to be in meetings with people who have lots of lived experience. So it's also a way to connect with them and to have access
Yes.
to them.
What a great idea. For everyone
Yeah.
listening, please go join your board, and especially your state organization. And if you're a student, get involved. And then,
And your board, every state is fighting for board members. You
yeah,
don't have to serve forever. You don't
yeah,
have to serve for 6 years. Maybe you serve for 2,
yeah.
but it will make a difference to the profession and it will make a difference for you. And yes, one time there was someone who wanted to be on the board so she could say she was serving on the board, but she wasn't interested in coming to meetings or working. And it's like, this is a working board. This isn't an in name only board. Sorry.
Yeah, you do need to do something probably.
You need to do a lot of things because it's not going to get done if nobody does it.
But so much that you can learn, so much about the profession, and so much that you can influence. And if you are someone who is opinionated or frustrated or wants change, my God, this is what people should be doing.
Ideally, yes, but advocating with compassion and ask questions instead of showing up to shame and blame. Ask questions. Can I, ask people to if they'll talk to you. I talk to people all the time. Oh, someone's confused about this. It's like, I don't want to spend an hour constructing an email. Can we have a 5 minute, 5 to 7 minute conversation? I think we can clarify some things.
Yeah.
And people appreciate that you give them your time. It
Yeah.
matters.
Yeah. Well, this is I mean, another we should all be I'm sure we are all familiar with being students in school and learning from the wisdom of those who've come before us as clinicians. And so it's the same here, right? Getting involved in the health and the functioning of our entire profession is the same. And learning from people like yourself, people who've been involved, who have set the standards and have been doing this hard work for so long. And now we need new generations of people getting involved.
Absolutely.
Yeah.
I serve on the Foundations of Oriental Medicine Exam Development Question Writing Committee. Say that 3 times fast. The people are unaware of the attention and intention that goes into just constructing one question, making sure that the question is not double keyed. Is the question entry level? Is the question appropriate? Is everything in integrity in the question with the treatment principle or diagnosis or whatever it is that you're seeking? Are all of the distractors reasonable? And is it about, could this be a plausible choice versus are we trying to trick someone? And every question also has to have 3 references. And we spend hours and hours on these meetings looking up all of this information. Then it
Wow.
goes to another committee that reviews all the questions. And then it comes back maybe with changes. And then we have to verify all the references again with the changes. It's a lot of work. Good
I
work.
think that there are probably many people out there who would want to participate on some level. Maybe not
Right.
all of that, but on
Well, nobody has to do it all. It's
yeah.
about what's the one thing you
Yeah.
want to do that you're willing to donate 2 to 4 hours a month?
Yeah.
Just pick one thing.
Yeah.
Maybe that's in your own community, right? Maybe that's going to a school and giving a free lecture about health, or going to your co-op and giving a free lecture about acupuncture or food, seasonal foods as we move into the fall,
Yeah.
whatever it is.
And then knowledge is power because you'll feel like you're being involved, you're giving to your community, you're also learning more from whatever
Hmm.
committee or organization that you are participating within. And I mean, we need to grow our profession and we need to have engaged, involved people with good intentions who want to see the profession continue.
Right. And one person, might be really invested in getting into their local hospital, and that's huge.
Yeah.
And there's the work of the hospital handbook group. And there's work of, that's going on at Alina Health in Minnesota, where they have more acupuncturists, I believe, in hospitals than any other state, and we can learn from that and look at how can we bring that. In my state, in Massachusetts, on the eastern part of the state, the teaching hospitals have acupuncture. None of the hospitals in Western Massachusetts have any acupuncturists on staff.
Wow.
So it's about, what are you passionate about and how can you bring that to affect change?
Yes.
Because I stand on people's shoulders and I need to have shoulders broad enough for people to stand on mine.
Yes, I am so inspired. Okay, so here's the list of takeaways from today for our listeners. So on a micro level for your own practice, make sure you know your practice act and make a good referral network so that you can, as an integrative practitioner, have people to refer to and then receive referrals from in your own practice. And then on a macro level, find what you're passionate about and get involved in some way. Join your state organization and then find that one thing that makes you tick or that inspires you to try to affect change or grow.
Yeah. And share it with others, because you never know. 2 of my closest friends I met through the PCOM doctorate. And one was an instructor and one was a peer. And they're my people. And it's a beautiful thing.
Yeah.
And I would never have met them had I not done that program.
Yeah. That's a good point. It's never too late to make friends in our profession.
In our profession and in our lives, everybody needs to be seen,
Yeah.
right? Because
Yeah.
if you're not seen, you're feeling squished. We don't want anyone to feel squished. We want people to feel supported and nourished.
We're ending up here. We're reaching the end of our time. I just every time when I end these interviews, I always ask at least something about what you're doing right now in your daily life. Do you have either a favorite practice, whether it's something herbal or something lifestyle, something?
Okay.
What do you
I
do to
I wake
stay
up
healthy?
I wake up between 5:30 and 6 typically. Roll out of bed, do 10 minutes of standing abs on a vibration board, then do 40 minutes on a wooden Pilates chair. Then I make my husband his coffee and breakfast because that's what I like to do for him. Take my herbs, my handful of traditional Chinese herbal medicinals and supplements, drink 6 to 12 ounces of water, and grab my dog, and we go by the river and we walk. We take a forest bath, no matter what the weather is, and walk by a river, and he gets to play with dogs. There's this whole other community of humans that, I interact with only there. And we have this beautiful walk. So I've got 2 forms of exercise. I've got an hour and a half of exercise before I even get into my office, just to be clear and present and centered. And I've eaten and I've drank water. I mean, I'm a
Yeah.
type 1 diabetic, right? I may have many, many days ahead of me. I may not. So that's also why, I want to leave every day on the mat, knowing that I've done everything I could that day to be an effective human being, to be kind, hopefully, and compassionate, and to, be inspired and inspire others and to serve my patients well.
Ugh,
That's my goal every day.
thank you for sharing that. What an amazing morning routine to start yourself off energetically and physically on the right foot
Hopefully. Sometimes
or
the
the left
left.
foot.
I'm a lefty, so.
All right. Thank you so much for being here today. I appreciate it so much for you sharing your wisdom and your decades of experience and all the hard work that you've done and continue to do for our
Thank
profession.
you. Thank you. It's a pleasure and a privilege to meet with you and to have the opportunity to share this with others. So hopefully it inspires one person. I was up. So I was doing political work for my brother. He was indicted for refusing to register for the draft in the 80s. This was before George Bush had everybody be automatically registered for the
Mm.
draft. So 19 men were selectively prosecuted for being pacifists and refusing to register for the draft. And my older brother, Andy, was one of them.
Oh my gosh.
So I was flyering at a leaflet at a Native American tree planting ceremony. And the medicine person took me aside and he said, "This is not your work. I don't know what your work is, so don't look at me, but this is not your work. This is your brother's work. And you will know you found your work when you help one person change the way they think about themselves." And that's what I do all day, every day. So I know I've found my work and I'm grateful for the privilege of doing it and for the vulnerability that sometimes is important for us to share with patients so they can access their own vulnerability, in appropriate circumstances to support them to heal.
Thank you. Thank you so much for sharing that. You are
Thank you.
doing your work and you have found your people. So thank you.
Thank you.
All right. Thank you very much, everyone, for listening today. We'll see you again soon. That's all for today's episode of Elevated Practice. I'd like to express my gratitude to our guests today and always for sharing their wisdom with all our listeners. I hope you were able to take away some insights, practical knowledge, or inspirational ideas that you can apply right away to elevate your own practice. You can find us on Spotify, Apple Podcasts, and YouTube. Don't forget to subscribe and tell your friends and colleagues about Elevated Practice. If you have an idea for an episode or a recommendation for a guest, please respond in the comments or message me, Gretchen Badami, directly through social media. Thank you, and I can't wait for you to hear our next episode.